Good day.
Hello.
I'm Christin Didoss.
I'm Hyun.
What's the reason for your visit? What can I do for you?
So I experienced pain in my right side of my eye, and it occurred yesterday and came out of a sudden. And yeah, I experienced a lot of pain in my eye, and I don't know what it is.
Okay. What kind of pain is that?
It's like I have a foreign object in my eye, and I cannot get out of this feeling.
Okay. And does this pain occur during any specific time during the day or when you do something?
Yes, it occurs in the morning when I wake up. Yeah.
Okay. In the morning when you wake up, do you also experience some tearing of your eyes?
Yes, I do. Every time I wake up, it tears a lot, and it's unusual for me because I usually dealt with dry eyes.
Ah, okay, okay. So have you seen a doctor previously to that because of your dry eyes?
I did, but he said that it's still a normal range, but he still prescribed me some artificial eye drops for a month, and I didn't use it regularly. I used it every time it felt dry.
Okay, okay. So when you look into the light, do you also experience other symptoms besides the headache?
Yes, well, everything looks like it's blurry. My eyesight didn't change, but everything looks blurry, and it's like a migraine.
Okay.
It's like really strong headache when I look into natural light.
But there's no nausea or vomiting?
No.
Okay, okay. Have you had any previous trauma to your eye, any incident or injury?
Yes, actually I did have. So 1 year ago, my cat scratched me in my eye, and my doctor told me that my corneal epithelium was injured. What he did was he prescribed me some pain medication and some eye ointment, and I used that. And he told me that I shouldn't wear my contact lenses, but I had to because I had to go to work. And it still healed, and after that it was fine.
Okay, so no complications ever since?
No.
Okay. So from what you're telling me, it sounds like you have something called corneal erosion. I'll look at your eyes with this microscope for now and look for some injury, and I'll apply this fluorescein stain, but don't worry, it won't hurt. It's just so I can see better. Okay. Yes, so I definitely see some injury to your eye. Corneal erosion affects the outer layer of your eye. The cornea, it covers the iris and the pupil, and it's an important part of the process of us seeing. And the cornea itself consists of several layers, and the outermost layer of it is detached from the underlying layers. And that's why you're experiencing pain and sensitivity to light, because the nerves are exposed now.
I see, but why did it came out of the sudden? Because 1 year it was fine.
So this condition in some patients can occur spontaneously in patients with specific risk factors, like for example eye dry disease. There might have been a contributing factor in your case, but you've told me so far you didn't have any problems with it yet. And other than that, it might have been a complication from your previous eye injury, so that's the reason oftentimes.
Okay, I understand. And what kind of treatment can you give me?
Yes, so for now I'll prescribe you medication against the pain. They're called NSAIDs, and also antibiotics to prevent eye infection. And because you wear contact lenses, I would advise you to not wear contact lenses for a few days, but if you have to, this antibiotic is specifically against a specific bacterium, and it's called ciprofloxacin.
Okay, I'll try to wear glasses in the future. Thank you so much. And can you tell me what can I do to prevent this from happening again?
Yes, so this condition is usually more severe in the morning after your eyes have been closed for a long time. They're more dry. So that's why it's important to keep yourself well hydrated and drink a lot. And you can also apply artificial tears in the morning, keep them in your reach when you feel like it's hard to open your eyes, or you can make a routine out of applying eye ointment in the evening before you go to sleep. So those are all the options you can try out. But keep in mind that some might not work, and you need some patience to figure out what's good for you.
Okay, thank you so much, doctor.
Yes, my pleasure. And please come back when this condition reoccurs. There's some risk to it, but let's hope this was it.
Okay, thank you so much for your time, for
Okay.
your help.
All the best for you.
Okay, thank you.
Goodbye.
Goodbye.